her parents don't speak English and they're currently in the hospital right now in LA. The doctor didn't speak Spanish, so they needed someone to translate, and at the hospital didn't have any translators, so my parents decided to just call me so I can talk to the doctor for them. Once the doctor was done explaining to me what they were going to do to my mom, she decided to give me a comment and say, "You should really teach your parents some English so they can learn how to talk in the hospital and communicate and stuff." But Spanish is the secondly most common language spoken in LA, and I just thought that for hospitals to not have translators and then to blame the patient for not knowing the language, I think it's just, I don't know, I didn't really like it. I don't mind translating, but I think that hospitals and other places should just do better, especially in LA because it's so diverse.
As a medical provider practicing here in America for over 20 years, I would like to share my take on this. The first thing is, the girl in the video mentioned that the hospital didn't have a translator. I'm almost certain they do. They are legally required to do so. And since they're in LA, I find it hard to believe that there's nobody in the whole hospital who can speak Spanish. Something's off in that story. I believe that the hospital reached out to her first because she's a family member of the patient. It's easier for her to communicate with her parents since the trust is there. Plus, she may know some important information that can help the doctor in assessing her parents. I don't believe that the doctor meant anything bad or any insult by telling her that she has to teach her parents how to speak English. I would believe that the doctor said that coming from a place of concern. But if there's an emergency and they don't have the time to get a hold of her to translate, yes, they can get a translator, but that takes additional time. But if they don't have the extra time? What if they don't have enough time to get a translator? Plus, when I do my assessment through a translator, it takes longer. In the hospital, there are a lot of patients, and there's no time to waste. For her to tell the hospital and other facilities like that to do better by learning to speak her language is a stretch in my opinion. What if I ask her the same question? Why can't she do better by teaching her parents how to speak English since we are in America? My mom came here barely able to speak English and she's old. Yet, she learned. It's not perfect, but she can communicate. What do you think? And follow me for more tips on creating raving fans.